I've been going up to Prescott for close to 10 years now, and I remember early on when we were just starting, it wasn't too busy. There were maybe 5, 6, 7 patients a day we'd see. We'd actually be traveling in the car longer than we'd be in Prescott, and I would take my whole team up there from Phoenix. We'd drive up and see patients, and you know, when asked why are we doing that, it's because there are a lot of patients there that don't have the means to travel down, and over the years that clinic has grown quite a bit, and now with the community up there, we've really established good relationships with the referring physicians, and we're doing a lot of good up there. We view this more as a service to the community. What it means for the community is there's less travel. Instead of driving 2 hours from Prescott down to Phoenix, they just have to drive 15, 20 minutes to their local doctor's office where we're working. And that arrangement has worked out really well. I think, again, there are a lot of conditions that need very regular treatment, and by missing that regular treatment, vision can decrease. And we understand that while going down to Phoenix once might not be a big deal, going down to Phoenix every single month at a prescribed time can be problematic. There's things that happen in life, and we don't want to see patients lose vision. You know, I think there's so many examples I could think of. One that I can think of, because I think about it daily, is there was a woman who's an artist, and she, getting on in age, started losing her vision. Got to the point where she couldn't, and she's a painter, she couldn't paint anymore. And she came in, both eyes had wet macular degeneration, and she came in saying that for the last year she hasn't been able to paint. And this was, at this point now, a hobby. She was in her 70s. And over a period of, it took a while, over about a year and a half, her vision improved and then stabilized to the point where she could paint again. And although I didn't realize when that start time of her painting resumed, she came in one day with a painting for me. And she explained how when she came in, she couldn't see to paint, and this was something that she loved and she lived for, and she brought a painting in for me, and that was very moving to me. In fact, that painting is up in my son's room, and so I see it every day, and I think about, you know, the good that we can do with our current treatments. And so this is an example of someone who probably would not have had such a good outcome if we weren't coming up to Prescott. She probably wouldn't have been able to make monthly appointments, and when that occurs, the results aren't going to be as good, and so this really changed her life, and we all have hobbies, we all have passions, and she was able to pursue that because she regained her vision.